When addressing osteoporosis, our attention has been on either using a bisphosphonate, but we know that that doesn't correct any imbalances, or calcium, which we also know does not necessarily build bone. So in order to correct bone loss, we have to correct the underlying imbalances, which lie generally in 5 areas. One of those areas is hormones. There are specific hormones that are responsible for building bone, such as progesterone and testosterone. This is precisely why men and women both start to lose bone somewhere in their 30s, because as progesterone and testosterone goes down, bone loss starts to increase. Other hormones that are critical include DHEA, which is a bone builder. There are specific nutrients in the second area that activate bone, and this goes much beyond calcium. In order to have bone building from calcium, you must also have the magnesium, the vitamin D, and the vitamin K, which are part of bone building. Otherwise, the body takes the calcium and deposits it as plaque in the arteries, and that's precisely why studies are showing that people who are on calcium supplements alone are having more stroke incidents. The third area are going to be the toxicities. The pH of the body being acidic critically dictates bone loss. If the pH is below 7.0, you can have the correct levels of hormones and the correct levels of nutrients, but they cannot come together to form bone. It would be like putting bricks together with watery cement. Another toxicity that affects bone is heavy metals. If you have mercury or lead in your body will be displaced of magnesium and calcium, which are critical to bone. The fourth area is going to be the state of your mind. If you have a lot of stress in the mind, the cortisol levels start to go up, and that directly will start to dissolve bone. The fifth area is going to be the state of the rest of the body. For example, are your blood vessels functioning well enough to bring the appropriate hormones and nutrients to the bone? Are your muscles functioning well and holding the bone in the proper place? So, in order to address osteoporosis, we have to go quite a bit beyond our traditional approaches and look for the underlying causes that cause bone loss and optimize them in those 5 areas that we just talked about.